welcome you to Future Nurse. My name is James Waldron. I'm a GP and I also work with the Nottinghamshire Alliance of Training Hubs. If anybody cannot hear me, please write that in the chat, or if they're having any particular technical issues, and we'll do our best. Hopefully you can all see the slides at the moment. So welcome on this cold wintry night. It would be a nice little bit of snow, but we'll have to do with driving rain if it's anything like what it is local to where I am at the moment. And welcome to our event. And you're here because I would expect you're interested in finding out more about a career in nursing. You're interested in finding about how to get into nursing as well. And you've absolutely come to the right place, because we've got lots and lots of information and insight that we can help deliver you today. And I'd also like you to welcome you to at least find out about the family that is the NHS and the family that is working with these wonderful colleagues. So what is this evening all about? This evening is about enthusing you. So exciting you about the career, exciting you about healthcare, exciting you about the service, exciting you about applying to getting into nursing school, nursing courses, and just really getting you excited about that application. And you might be pretty sure that's what you want to do and you are working towards it and you're going to apply in January, or it might be something that's a couple of years off and you just want to find out a little bit more about it and find out if it is for you. And we want to really encourage you and excite you about this amazing career. Today's also about information. There'll be a lot of information that will be delivered, and some of this will be really practical about getting into university itself. Some of it will be more experiential about actually what it's like being a nurse, actually what it's like being a nursing student. There'll be a lot of info, and we're going to be able to deliver some of that to you in sort of word form afterwards. But we're also going to hopefully pop this up on YouTube afterwards. As I said, we're recording it so that you can look at it, and you can also share that with your colleagues or anybody that might not have been able to attend today. And this evening is about insight, and I think one of the great things about this event is that we can really show you the perspective of these student nurses and some qualified nurses as well that are currently doing the job, currently doing the studying, and that insight is really invaluable. And so what I'd like to urge you to do is interact with us, ask lots and lots of questions. There's a Q&A function which I'll explain to you in a second, but this is your opportunity to ask the experts, ask the people that are experts going through it at the moment, those questions that you have. And we're happy to answer anything about nursing, about what's like being a nurse, about the course, about what people do in their social time, about how they let off steam. So please feel free to ask all those questions and take advantage of these amazing people that we've got for you today. And it's also helped link you in with people, link you in with our experts, link you in with the training hubs, and the information is going to be going into the chat box, and you can interact with us on email, and you can do it on Twitter as well. And we are going to be tweeting along as we go through here. It's going to be #FutureNurse. And also remember that this year is the year of the nurse and the midwife. So a very auspicious year for applying for training too. So a little bit more about you, and thank you for those of you that have already contributed to the Mentimeter. So I'm just going to move on, and if you have a look back down at your device now, you should be able to see the next question. And we really want to know where everybody's from, about where you're joining us from, how the people that we've reached out to today. So if you'd like to go back on menti.com, so that's the code is 5065543, or follow the link that's been in the chat there. You should be able to interact with us. So where are you joining us from? Where do you live? Where is that? And is that Nottinghamshire, Derbyshire, Leicestershire, Lincolnshire, further afield than that? Brilliant. And again, I think this is really nice because as we were talking about being in a family, being in a bit of a fraternity or a sorority of nurses, knowing that there are so many other people in this talk here that've got those same interests and same hopes that you do. Aisha and Eloise, brilliant, thank you. If you wouldn't mind popping it in the Menti, and that'd be really great. So because that way we've got like a lasting record. So if you've gone to menti.com, if you can, and pop in where you're from there. Absolutely. And you can do it on your phone or your tablet. You have to do it on your PC. You can. That's brilliant. Brilliant. So we've got people from all over. We've got Scampton, Retford, further afield, we've got Nottingham, Nottinghamshire, Leicester, Lincolnshire. Brilliant. Derby, West Bridgeford, Worksop, Ashby. Gosh, all over. So that's really amazing to see how many people we've got from all over the place. Excellent. That's really great. Okay. And just moving on, so we're going to ask you another little question today. Again, so make sure that you can get the most out of today. And everybody can still interact as we go through. So what is it, and I want to ask you, and you can take a minute or so, what is it that most interests you about being a nurse? What is it that's most interesting and exciting? What's the thing that most interests you about getting into a career in nursing? It's just a few words. You can write a little bit more if you want to, but again, this will help us tailor what we do today to help us tailor what we do today to what you've asked about. So some people have written helping people, working with people and children. Absolutely. So one of the best jobs for meeting people, helping get people back to reality and feel like themselves again. I think we all really need a bit of that at the moment. Caring, feeling of achievement from helping people. And absolutely, it's one of the best feelings ever when you can really help support someone and make a difference in their life. Giving back to the community, helping other colleagues, other nurses, meeting people from all backgrounds. Absolutely. And nursing can take you places, healthcare can take you places, huge numbers of transferable skills. Rewarding job, positive impact, being there for people. Job security, absolutely. Yeah, job security is really important in this day and age, and it's a very secure job. There's always need for nurses. There's so many options and career paths that we can go through. That's amazing. Thank you so much. Right, well, people can continue contributing to that. We've just got one more question. What do you hope to get out of this evening? What is it that you hope that we can impart on you today? What questions would you like us to answer? You can pop them through the Q&A as we go through, but what is it that you want to experience from today? What can we help you with? Right, more information about what nurses do. Okay, brilliant. We can certainly help with that. Insight into midwifery. So there's going to be a little bit touching on things about midwifery today. So today's talk is mostly about nursing. It's mostly about nursing and particularly adult nursing as well. And we will touch on those other areas, but particularly about adult nursing. But we'll see what we can do. And we can always link you in to others that might be able to help direct you more along the midwifery route. Better understanding of nursing careers. We can certainly help with that. Different types of nursing, yeah, we'll really focus on that. We've got lots of people with different interests later on. More about studying and the experience there. Reassurance on taking the correct career path. Absolutely, it's all about us enthusing you, and it's really important that people find out it's the right thing for them, and just sort of exploring it. And you've taken the right step by coming to today's talk. Information daily life as a nursing student. Well, we've got some people here who would love to fill you in on that. Educational aspects of things. What's needed to get into nursing from secondary school? Yeah, we're certainly going to look at that as well, and hopefully at least be able to fill you in on some of those bits. Of how to apply for university, what the courses involve. Do we have to do biology to get in? That's a common question. We'll certainly answer that one. Which A-level courses are recommended? Different paths to career in paediatric nursing. So we will touch on that again. So we've mostly got adult nurses for us here today, but we will look to explain that a little bit as well. Okay, learning what life as a nurse is like. And that's absolutely what today is about. So we can really touch on those things. So thank you so much for your contributions. I'm going to keep an eye on that as well. And this slide will stay up. So please continue contributing to that as we go along. Right. So thank you very much for that. Hopefully people can see the PowerPoint again now. So the plan for this evening is we're going to talk about routes into nursing and entry requirements. We're going to talk about student experiences. We're going to hear from our wonderful student ambassadors about their experiences for nursing. We're going to find out what's like working as a registered nurse, and then we're going to have a good Q&A at the end. And that's your real opportunity to find out from the experts and find out and have all your questions answered. So as we've been talking, so please feel free to contribute in the chat if you've got any comments or things you just kind of want to make as statements. But if you'd like to ask questions, there's a Q&A box at the bottom of your screen, and that's on your phone, or that can be on your computer or tablet. Click on the Q&A, you can ask a question. And we've also got the opportunity here for people to upvote questions. So if you have a look at the questions, you see there's one that you think particularly should be answered, please feel free to give that an upvote. And that way we'll be able to make sure that it's answered. And we'll come to that at the end, if that's all right with everybody. So please make sure that you pop in the Q&A there. So without further ado, I'm going to hand it over to my colleague, Lisa Freeman, who's going to talk to you about the entry requirements to BSc Honours in Nursing.
Hi, so my name's Lisa Freeman. I just want to welcome everybody here this evening. So I'm going to just talk a little bit about how to get into university, what kind of requirements are, what the expectations are, sort of like a little bit about careers in nursing, where you can go. Next slide. So there's lots of different access options into the nursing BSc. So you can go in via the Access to Higher Education diploma. So with a total of 45 level 3 credits. There's the BTEC options, which they usually require a distinction merit. The requirements are, for most universities, you need at least 3 GCSEs, grade 4 or above, including English, maths, and preferably a science or equivalent. And they look at functional skills at level 2. So as long as the UCAS tariff adds up to a total of 112 points, you can get in on the different access options. If you go in via the direct A-level entry, the usual requirements are 2 Bs and a C. So somebody asked on the chat earlier, if you got 1 grade below your predicted, could you get into university to do the nursing degree course? The answer is yes, because lots of universities also consider applications on a very much individual basis. Next slide, please. So the UCAS cut-off point is looming. So the next slide is the date of the 15th of January 2021. So that's the closing date for all UCAS applications for the September intake of 2021. Next slide. So how do you study? So the course is a full-time university programme, and there's lots of universities to choose from across the whole of the Midlands. So we're looking at Derby, Nottingham, Leicester and Lincoln, but you could go to any university across the whole of the country. It's a full-time course with a mixture of university and practice placements. The biggest bonus with the nursing courses, there's the availability to claim the NHS bursary of funding of £5,000 towards university fees and costs. Next slide. So there's 4 branches of nursing. So these are the general nursing, that this is excluding midwifery. So there's adult, children, mental health, and those with learning disabilities. So that's the 4 branches of nursing. Next slide. So what can you do with nursing? So basically, the world's your oyster. What careers can you go into? Next slide. So where do you think you may work as a nurse? So there's lots of different options. So you could work in primary care, so that's in general practice. You could work in secondary care, sort of like a hospital, a large hospital, small hospital. You could work in the community. That could be working as a district nurse. That could be working in a local community hospital. You could work in the armed forces, the prison service. You could work within education, so teaching other nurses practical skills. You could work within research. You could work in the private sector, a private hospital, private care facilities. You could work in public health. So there's lots and lots of different options. Next slide. So there's lots of career development and career opportunities within nursing. So as nurses, it's ongoing development. So you do your nursing degree course, and then it's training to do different specialities. So it could be a postgraduate certificate, it could be a master's qualification, and if you wanted to do research, you could do a doctorate. So you start off as a band 5 with a starting salary of just short of £25,000 per year, but the potential within nursing to sort of move up and earn sort of like significantly more. So if you were working sort of in the hospitals on an agenda for change, you could earn up to sort of 53,000. Next slide. Thank you.
Well, thank you very, very much, Lisa, for that, and obviously lots of information there. So what we'll do is, if anybody's got any thoughts or questions about that, please feel free to pop them in the Q&A, and then we'll come back and we can kind of explore corners of that later on. Now, I'm very happy to be able to bring you for the next part of our talk. 1 second, he says. Next part of our talk. The really exciting bit of nursing training through our experiences. And we've got some wonderful student ambassadors here who are really keen to tell you about what it's like being a nurse, and they are nursing students right now. So without further ado, I'm going to hand it over to Rebecca, who will speak to you. Hi, Rebecca.
Hello. Hi.
Hello. Welcome.
Hi. Yep. So Ruth is kindly going to share my slides for me, just while we're waiting. My name is Rebecca. I'm 28, so I'm classed as a mature student, and I'm currently doing adult nursing at Lincoln University. So when I left school, I had no idea what I wanted to do. Yep, next slide, please, Ruth. I had no idea what I wanted to do. My grandma had always said that I should be a nurse, but I was obsessed with hair and makeup, and I didn't think nursing was for me. So I thought it would be a really good idea to do a hairdressing apprenticeship, but it turns out that really wasn't for me. After I did the apprenticeship, I worked in a care home. I absolutely loved it. I worked really closely with nurses there, and after a few years, I decided to go to college to do an access course. Because I didn't get my A-levels at school, the access course was the fastest way for me to get into university. So I went to do that. I completed the course in 2015, and then I still didn't go to uni. Really randomly went into a state agency and ended up being a manager in a state agency for 4 years. And then last year, before COVID, I finally took the plunge, and I got accepted onto the adult nursing course. It was meant to start in September of this year, but it was pushed back a year because of COVID, so it started in October. I didn't move into student accommodation mainly because I'm too old. So I live in a house. I rent a house just outside Lincoln with my pet pug who's snoring in the background. You might be able to hear her. I am planning to buy a house once I'm qualified, and I know a lot of students on my course anyway did move into student accommodation and got placed together. So that's really handy for them. Next slide, please, Ruth. So nursing in general is quite competitive to get into. I know a lot of people applied for nursing at Lincoln when I applied, and a lot of people that applied for child nursing or midwifery also got accepted onto the adult nursing course just because of places. So they're taking that course and then going into the child nursing or midwifery through different routes. I would say a great personal statement is absolutely key. Obviously, that's what they're reading. That's their first impression of you. So just let your passion shine through and show them why you really want to do it. I did a lot of research before applying, and I found that there's so many different pathways in nursing, and there's so many different areas that you can specialise in. I really wish I had done it sooner. Next, please. So I'm in year 1 at the moment. All of the nurses are learning together. We learn together in year 1 and year 2 now, I think, as well. Things are a bit different at the minute because of COVID. We're currently well, we're not now, but we were only going into university once a week for our clinical skills. So far in our clinical skills, we've done things like injecting fake skin, giving out medication, which was actually just Skittles, but we followed a medication chart. We've done basic life support, safe moving and handling, stuff like that. We've covered loads more than I thought we would at this point, and I feel like I've gained so much knowledge already. We were due to start our first placements in December, but they were pushed back to January. So instead we got offered to do the COVID testing on students that were going home. So we were doing that at the beginning of the month. We just stopped that last week. So that was really interesting to see, and obviously quite unique. I don't know if anyone's going to get the experience to do that again, but that was really good. So we got our placements this evening. Actually, we got allocated our placements this evening, so it's really exciting. We're in a really big group chat, all of us student nurses, and everyone's talking about that tonight, so everyone's really excited for that. Next please, Ruth. Once I'm qualified, I'm planning on going into general practice nursing. I'm really lucky in that I know what I want to do, but I know a lot of students on the course don't know what they want to do yet. They're just going to go with the flow and see which placements take their fancy and what they really like. After my degree, I'd love to become an independent prescriber, and the ultimate aim is to become an advanced nurse practitioner. And that's it. Thank you.
Thank you so much for that. And moving on to our next student ambassador. Unfortunately, I don't think Rachel's going to manage to join us, but we've got Imogen for you. Welcome, Imogen.
Hello, everybody. Just give me a second while I share my screen. There we go. So hello, everybody. My name is Imogen, and I am a third-year student nurse at the University of Lincoln. I'm training as an adult nurse, and I'm going to qualify in August 2021. And after that, I will be a community nurse in rural Lincolnshire, but I'll talk about that later on in my presentation. So why did I choose nursing? Sounds cliche, but I have always wanted to be a nurse, although lots of people know they don't, and it's a bit of a last-minute decision out of my group of friends. But I knew from a very young age that that's what I wanted to do. And I've been quite lucky in that I've been able to choose all of my life plans around that. So having a childhood brought up in quite a community spirited way has definitely helped with that, because I joined a lot of clubs and charity events then, combined with a fascination of science and a compassionate mindset, really did help me decide to be a nurse. I've always been really curious and intrigued about what happens in hospitals, because you see on medical documentaries and dramas these things that happen, but until you're in that environment, you don't really understand or even know why things are happening. So if you're quite curious and intrigued like I am and was at that point, this is definitely a great career for you. Of all the healthcare roles that there are, I chose nursing because it's such a unique path, because you are the one that all of the other healthcare professionals come to about your patient. So generally the doctors will go around a hospital but cover various wards and see specific patients on your ward, but you are the one that knows the patient and the family and has a good relationship with them. So yeah, that's why I chose that. So because I knew from an early age that this is what I wanted to do, I based my GCSE options around it. So at my school, we were allowed to choose 3 optional subjects. So I did health and social care, geography and history. Health and social care was definitely my favourite part, so that was a good decision. And it's not necessary for you to know right now what options you're choosing. These ones that I chose were classed as facilitating subjects. So that means that they could be applied to lots of different sectors and courses. So they present with a wide career choice if you want to go. And then after that, I moved on to the sixth form and I did psychology, sociology and RS. I get asked quite a lot why I didn't do a traditional science like biology. And and I did the 2 social sciences instead. This is because I thought that they would put me in better stead for going into my nursing, because they cover a wide area of theory what you would cover in uni, and a lot of the things I learnt at A level I've also covered in my lectures as well. So yeah, but the biology at my school covered a lot more about plants and photosynthesis and less about human biology, so I thought these 2 would help a bit better, and they were really interesting. So that automatically gave me a rounded view and base of knowledge for my nurse training. But please check with your university entry requirements that you're looking at going to, whether they will accept the social sciences or they have to be a traditional science, because I know that some can be quite picky. So just clarify with your uni which one that you're doing. I also at this time volunteered at a local care home. So in my free periods at sixth form, that's what I did to give experience to put in my personal statement. And I also joined St John Ambulance in year 11 as a cadet. So again, that was great experience, and I'm still with my local unit now, attending weekly meetings and going out on events when we can. And that leads you to a lot of emergency care. You work alongside paramedics and all sorts of other healthcare professionals. And I also arranged my own work experience at Papworth Hospital in the summer between year 12 and year 13, and that was great to add to my personal statement. And then I also had part-time employment as well, so that showed great leadership and management skills and responsibility that universities are always looking for. So sixth form was a really, really busy time, and if I had to give you advice, make the most of these 2 years, because they will go so quick, and your personal statement is the thing that universities will really look at when selecting the people onto the course, and as much relevant experience and passion you can share, the better. So, a day in the life at university. My course is split 50-50, so we have to do 3,700 hours of practice and 3,700 hours of theory. So at the minute I'm on Christmas holidays at the minute, but I'm in a block of placement. So I'm on a 10-week placement in a community hospital. So this could cover, and you're supposed to cover different areas of care. So surgical, medical, community care. So that could be district nurses, doctors' surgeries, community wards like I'm on now. Acute care like A&E. Specialists, so things like outpatient specific appointments and clinics. And then my university also has an elective placement where you can choose exactly where you want to go. Could be anywhere, could be abroad. That 4 weeks is for you to completely choose where you would like to work, and potentially for your management in year 3. This is slightly different in terms of you're limited on your choice, but most people already have their jobs in place and do their management placement there, your final placement, and working towards your newly qualified nurse status. But then when I'm at university, this is a mix of clinical skills training. So that could be anything from wound dressing to continence to basic life support. And then we also have lectures, which is where one teacher will stand at the front of a lecture hall, could be 200 people in the room, and you just make notes and listen. And then that's generally followed by a seminar afterwards. This is probably about 30 people in a group mat, so you discuss what was learnt at the lecture, any questions you have. And then sometimes you would have tutorials, which could be one-to-one with a tutor, or again in the seminar groups where you cover basic admin-y tasks that you have to do for the NMC. So my student experience so far: first year I lived in halls of residence with five other students, none of which were doing nursing students, which had its pros and cons. Sometimes it was nice to switch off from your nursing mindset and talk about other things. Other times you wish that they understood what you was going through. because nobody will really understand a student nurse perspective unless they are a student nurse, because you're always in that bubble between student and working with healthcare professionals who are married and got children and things. So it's a very specific group to be in. Second year, I moved in with 3 friends, 2 of which that were on my course, and this year I live at home with my parents in Lincolnshire. I think that there's a big misconception that student nurses can't have a life outside of the course. This is completely wrong and a myth. I have a part-time job and also do bank shifts at the local hospital. I have a relationship, I see my friends. So as long as you have good time management, you can do exactly what you want. That is the key to the course, having good time management. Highlights, I would say meeting friends who have the same passion for me and that we're all going through, and it's really lovely to see everybody that on my course getting their job offers now, ready for next summer. The light at the end of the tunnel. It's been a long 2.5 years, but a great one at the same time. I wouldn't regret my choice at all, even with COVID. Half of my course has been online, so switching from that mentality of going to physical lectures and seminars to all be online was quite hard. So that would definitely be a challenge, and all of my exams and things being rewritten, but you have to adapt being a nurse. You have to be very flexible, so it's definitely tested that part. I also liked living on my own independently. That was great, and I learned a lot from that. And the other challenge I'd like to mention is that working at level 6 standard is quite hard. I'm not going to lie to anybody. Referencing and literature searching is a tough job. Probably I would say more so than the practical, because I am more of a practical person than an academic. But if you work hard and university gives you great support, there's no reason why you can't get a great score. Okay. So my future plans is, like I said, I'm going to be a community nurse next summer. So this means going around to people's houses or care homes that can't get to the doctor's appointments or clinics. So it could be going around and doing leg dressings or injections or catheter care, anything that a nurse would do in a hospital, but for those that can't get out. Looking more long term, I would perhaps like to do my advanced nurse practitioner training, which is where you're working at a junior doctor level and can assess, diagnose and treat the patients. Or perhaps a specialist nurse, maybe a palliative specialist nurse, or maybe even going on to do a master's and being a dual qualified nurse in paediatrics or midwifery. So yeah, that is one of the definite best things about being a nurse, that you can really do anything, and if you get bored in one area you can always switch up and you will always be learning. There's never a day where you don't learn something new, so you'll never be bored, and I can't recommend this career enough. So hopefully you're all going to be nurses. Thank you for listening.
Well, thank you so much, Imogen. That was really great insight into it. Sounds like you're having a great time, and hopefully that's really inspired some people. So without further ado, I'd like to move on to our next section, which is called A Day in the Life. And so we've got 2 wonderful qualified nurses to speak to today, Lucy and Hannah. I think, Lucy, you're first up. So if you'd like to come on.
Just sharing more. So sorry about that. I'm a practice nurse, as you can see from the title of my presentation. My background, I was actually a chef for 10 years, so I was classed as a mature student as well when I applied for university. I originally wanted to be an accident and emergency nurse, so in secondary care. Really loved the idea of it. That was what I was dead set on from the start. And I got a place at De Montfort University through the clearing process. But that's a bit of a long story. I thought I wanted to go into paramedic science and change my mind to nursing through some really good advice off another nurse. I was assessed for my learning needs, got the support I needed for my dyslexia, and found different ways to learn, so that really helped. Fast forward a bit into the nursing degree, 2.5 years, I had a random placement at a city practice. It's actually a training practice for Leicester. Covers about 18,000 patients, and I loved it. It was brilliant. I met a lot of the patients that I still deal with on a daily basis today, and I got a lot of support from the team there, and that completely changed my mind and made me want to go into primary care, and in particular practice nursing. So the day in the life of a practice nurse is it's a bit difficult because every day is different. That's a list of some of the things we do, and I always miss a few things off. But these basic appointments can sometimes turn into something different because patients have got other questions. You really get to know the families and the whole patient group, so it's good for continuity of care, because as they get to start to know you, they sort of feel comfortable talking to you about other things, and you can help them a lot more. And you see all ages as well, so from babies up to, I think the eldest patient in our practice is 104 at the moment, so, and they still attend for appointments. Some of them, it's quite amazing really. So the thing that's good about general practice is that you're doing a lot of different things. I can be doing injections 1 minute and chronic disease management the next, so things like asthma, COPD and diabetes. So they're just annual reviews and just checking that the patients are okay with their medications. Travel vaccines, obviously we're not doing at the moment, but your geography definitely improves with that, and you learn a lot about other countries, cultures, and what people need to go to that country and the risks involved. So healthy lifestyle advice, it's given throughout all of these appointments really, and you can really help the patients adopt healthy habits, especially when they're feeling comfortable to talk to you about it, and they ask you for advice about it as well. Helping individuals with mental health issues. So I mentioned some of the basic appointments can actually, once the patients feel comfortable, can actually turn into a bit more of a signposting appointment, where they may need to see a doctor straight away, they may need to talk to a doctor. And my experience was that a blood test actually turned into sort of quite a serious mental health signposting event. And it's just so different every day, and you learn a lot from those experiences. You're not like stagnant with your learning. I've been on a course, I think every year I've been there. I'm actually on a asthma diploma course at the minute and due to start my prescribing in January. So it's really something that I'd really encourage you to look at. And if you are considering practice nursing, maybe look at a training practice, because that's where all the trainee doctors, student nurses, and they're normally really good at supporting you and encouraging you to do different courses as you go along. And that's it really. I mean, that the quote on the left is, you choose a job you love and you'll never work a day in your life. And it is hard, the training's hard, and you will have days where they're a bit more stressful than others, but overall I don't actually feel like I'm going to work. So work-life balance as a practice nurse is brilliant. And well, thank you for listening.
Well, thank you so much, Lucy. That was really interesting. Lovely insights into your day there. Next up for you, we've got Hannah Daniel, who is going to talk to you about being a nurse, and is a fully qualified nurse. So hand over to Hannah. Welcome.
Thank you, James.
No worries.
Just get the slide shared for everybody. So hi, I'm Hannah, and I'm just going to talk about my job as a practice nurse today for you. Next slide, please. So I'm a senior practice nurse in a rural GP surgery in Lincolnshire. And I'm also a lead nurse for the Lincolnshire Training Hub, so I help doing events like this and other people across the county. A little bit of background to me. So I went straight into nursing from secondary school. I did my A-levels in biology, chemistry, physics and maths, and I went to University of Nottingham and studied a Masters of Nursing Science. So there's a little bit of a typo on there. I started my training in 2013 and I finished in 2017. And my first job was as a general practice nurse fellow in Lincolnshire. So what that was, it was an opportunity for newly qualified nurses to go into general practice. And I worked alongside Lucy on a project with Health Education England, as well as doing my normal practice nursing role, just to help integrate everybody and see how the greater NHS system works, because it's a little bit of an unknown thing at times, can be a bit daunting. Next slide, please. So every general practice works differently. So to give a bit of background, my practice, it's rural in Lincolnshire and we have quite a well-off population. So we get a lot of worried well that attend our practice. In general practice, there's a wide spectrum of things. There's a general conception that, misconception rather, that general practices tend to have a 9 to 5, Monday to Friday role. That's no longer the case. Practices work on evenings, weekends, late nights, bank holidays and all that sort of thing. In our practice, I work Monday to Friday, and I start at 8 o'clock in the morning. So we run clinics that are set for particular topics. So, for example, asthma, COPD or spheres. But other practices will do a bit of an ad hoc thing. So it may be that they're seeing a smear 1 minute and then they're doing baby immunisations the next. It really depends what works for the local area. So in my morning, I'm the respiratory lead for the surgery. So I would do the annual checks for people with asthma. But I'd also see those that are unwell. So I'd see those that have been recently discharged from hospital, people that have had chest infections. They may have had an asthma attack over the weekend or something. And I bring them in and see them. But during that time as well, you also get messages sent through to you. So it might be that somebody has woken up that morning and their asthma suddenly isn't very good and they need seeing. So there's all those opportunities to put your thinking cap on and make your brain hurt a little bit, especially on a Monday morning. The later in the morning, I might do a smear clinic. And to be honest with you, that's one of my favourite times, because you get to have that really intimate conversation with a lady. So you get to discuss their cancer screening, but you're also talking about sexual health. They may come up to you and talk about their mental health, and lots of opportunities there to explore those things. It's not just the smear that you'll be discussing as well. It may be that they want to talk about menopause, or they may want to discuss breast screening, or they may come to you and say, I'm really worried about my husband. He's getting up to go for a wee in the night and just want him checking out. So lots of conversations that you can have in there, which is really quite nice. And you get that personal one-on-one time with somebody. Afterwards, I might have a bit of admin time. So I do the lead role in the surgery. So that might be that we do a bit of staff training. It could be that we're planning for clinics. So big thing in the news at the moment is all the COVID vaccinations, and our area has started the COVID vaccines now. So all the planning for that was being done in these admin times, as well as infection control, which I'm sure you've heard is super, super important at the moment. So making sure the surgery is nice and safe for everybody. We tend to grab a little bit of lunch about 1 o'clock, which is quite nice, or go and meet in the staff room if you are able to. Or go out for a nice walk, which is quite lovely in our area. We've got a nice little orchard in our back garden, which is beautiful in the summer. Next slide, please. So in the afternoon, we shake it up a little bit, because variety is the spice of life, as I say. So we do a little bit of baby immunisations, for example. So that could be that you're seeing babies typically from about 8 weeks old. You can see them from as young as 4 weeks old to start vaccinating them. And it's not just the babies that you're vaccinating, it's also that you're looking after the families. You could be looking out for safeguarding issues, and you just sort of get to know everybody. And what I quite like is I've been in the surgery now for 3 years, and I've seen the babies that I first started vaccinating when they're 8 weeks old, and they're now 3 years old and coming back for their preschool vaccinations. So you get to see their journey, and you get to see their little siblings coming through as well, which is lovely. And then we can do treatment rooms in our practice. So treatment room for us is a bit of a mixed bag. So we can be doing injections for people that have got prostate cancer. We could be doing wounds for people that have got leg ulcers, or they could have had some surgery. They could have recently had a cesarean, C-section, or anything like that. We'll also do ECGs, ear cares, and we get a lot of urines that come in through the door. We're sorting out the urine infections and arranging antibiotics and bits and pieces. We can also give other medications, so your B12, or it might be that people are transitioning and you're giving them testosterone or something like that. And then in our surgery, we also do minor surgery. So some nurses do the minor surgery themselves, but in our practice, it's the GPs that currently do it, and we support them, so we can help them remove lumps and bumps from people, and be the supportive hand holder for the person that is having something removed that they may be a bit nervous about. And then because we're in a rural practice, it's around about 50 minutes for us to a hospital of any sort. And so we're actually a minor injuries unit. So we get anything walking through that door. It could be that you've run 111 and they say, can you go down to Hannah's surgery and have a look at them? But say just a few examples of what we've had recently. We've had peas up somebody's nose that a little, I think she was about 18 months old, thought it was absolutely hilarious that she had peas up her nose, but Dad was not so happy that had happened. We've had people that have burnt themselves leaning over a hot kettle and the steam's come up out of the spout and burnt them. Cuts and falls, and that's quite a big one. We had a phone call just last Friday, actually, to say that somebody's fallen in the street, and the message was bones showing. So we were a bit like, oh, okay. And so people can bring people along, we suture. But we also do the larger emergencies. So we also have people that attend that are having strokes, heart attacks, asthma attacks, those sorts of things. So we do the full mixed bag. You really never know what's going to come through your door at all. And then my typical day will finish around about 6:30 in the evening, and then we get to go home. So all in all, you never really get bored. That's it. Thank you.